When you look at patients that have been exposed to IMiDs, proteasome inhibitors, CD38 antibodies, those triple-class exposed patients have poor outcomes, especially when they are triple-class refractory. So refractory to PI, IMiD, and a CD38 antibody is associated with an overall survival of only 12 months. So we need new agents for these patients. The good thing is that we have now several drugs recently approved for these triple-class refractory patients. We have Melflufen, we have Selinexor, and the BCMA antibody-drug conjugate Belantamab mafodotin. This is a antibody with attached to the protein a warhead, in this case monomethyl auristatin F, which is a microtubule inhibitor. And in that way, the BCMA antibody can bring this toxic molecule to the tumor cell and kill the tumor cell. Belantamab mafodotin has a overall response rate of approximately 30% in triple-class refractory multiple myeloma and a median PFS of also approximately 3 months. So this is an agent that we can now give in Europe and in the United States in triple-class refractory myeloma. Also recently approved is the first CAR T-cell product, Idecabtagene. This CAR T-cell product targets BCMA positive tumor cells and induces a much higher response rate, 70%, 80%, also with deep responses and a median progression-free survival of approximately 12 months. The big advantage of CAR T-cell therapy is that it is a single infusion, after which the patient has a treatment holiday, which is very comfortable for the patient, also when it comes to quality of life, because otherwise the patient has to come to hospital frequently. Toxicity of Idecabtagene is cytokine release syndrome in the beginning, mostly 1 day or 2 days after the infusion, and in some patients, some neurotoxicity, often coinciding with cytokine release syndrome. Infections can also occur in these heavily pretreated patients, and you have to be careful and treat the infections in a timely fashion. The Stilta Cell is another CAR T-cell product that's very advanced in terms of clinical evaluation. It has a higher response rate, 90%, and also a higher rate of complete response. It's also associated, its toxicity consists of cytokine release syndrome and some neurotoxicity, the classic neurotoxicity that coincides with cytokine release, but also with Stilta Cell, it has been described that some patients experience delayed neurotoxicity, which can consist of movement or cognitive disorders or neuropathy. And recently, this type of delayed neurotoxicity has also been described for a patient treated with Idecabtagene. And then another important class of new agents is the class of the bispecific molecules. Biospecific antibodies bind to CD3 on the T cell and most of the time to BCMA on the tumor cell, and thereby T cells are redirected to the tumor cell and the tumor cells are eradicated. BCMA bispecific agents are very effective with an approximately 70% response rate. And also deep responses can be seen here. 20%, 30% of the patients achieve CR, a substantial number of patients a VGPR. Cytokine release syndrome is also often seen with bispecifics, but is typically less severe than what is seen with CAR T-cell therapy. And also you have to be careful here with infections, partly because these patients are very heavily pretreated, and partly because these patients develop hypogammaglobulinemia, because also normal plasma cells are eradicated. The advantage of bispecific antibodies is that they are directly off the shelf available, which is very convenient for patients with rapidly progressive disease, for which the manufacturing of CAR T cells can be cumbersome. A disadvantage of bispecifics is that you have to give them continuously, often until progression. So many bispecific antibodies are targeting BCMA, like Teclistamab, like the compound from Bio and from Pfizer. But there are also new bispecific antibodies that target other antigens, such as Talquetamab, targeting GPRC5D, and Cevostamab, targeting FcRH5, which is important because BCMA expression is heterogeneous, can be lost after BCMA-targeted therapy, and in those cases, other targets, bispecific antibodies targeting other antigens can be effective and helpful for the patient.